Hi, my name is Sydney Watt, and today I will be discussing whether or not Toledo Hospital is prepared for a mass casualty incident. So, this is a comparative analysis of disaster planning at ProMedica Toledo Hospital versus the Standard of Excellence by me, Sydney Watt. So, a little bit of background on Toledo Hospital. It is a 794 bed nonprofit hospital in Toledo, Ohio. It's our level one trauma center, and it is definitely the biggest hospital that we have in the Toledo area. And also included in this is an 169 bed level two pediatric trauma facility, which is our Russell J. Ebi Children's Hospital. So Toledo Hospital is huge. So the disaster preparedness team at Toledo Hospital, we have Arturo Palazzi, who is the president of Toledo, Ohio. We have Andrea Williams, who's the chief nursing officer, Dr. Brian Kaminsky, who's the vice president of medical affairs, and then Dr. Michael Madden is who I actually interviewed for this project, and he is the director of the Toledo Hospital Emergency Department who responds to the disasters. So first, before I started writing my questions, I just Googled what a mass casualty incident was and the five steps of emergency management from the Federal Emergency Management Agency. So a mass casualty incident is kind of just self-explanatory. So when we exceed what we can handle in the hospital, pretty much. And then the five steps of emergency management is how I framed a lot of my questions. So I tried to frame my questions in a way that they would touch on prevention, mitigation, preparedness, response, and recovery. So there's my questions. I just wanted to make a few about the like mitigation and preparedness. I feel like I didn't make as many questions about those, but I did make a lot of questions about the response and recovery phase, just all together. So these are my questions. So, what is the standard of excellence for disaster planning? Is another question that I did have before I even started my project. So, I looked on the National Incident Management System, or NIMS. I looked on their website. They did have a framework for each mission area. So, they had one just for prevention, mitigation, response, recovery. They didn't have one for preparedness, but it was kind of the protection one was kind of preparedness. So I used that one, and they were just a really good resource for me throughout this whole project. So, prevention and mitigation of a mass casualty incident at Toledo Hospital. So, this was some of the things that I asked Dr. Matten about, and we do as a whole hospital. I work in oncology, so I don't work in the emergency department specifically, but I do work in the hospital. So, in the whole hospital, we do biannual safety drills, and we make sure that everybody is up to date on what we do in increment weather situations, or if an active shooter comes into the building, we make sure everybody knows what to do, and that is at least twice a year. Triage practice happens in the emergency department. That was what Dr. Michael Matten was telling me. Everybody knows how to triage in the ER. And then one thing that I know from personal experience that we did during my orientation is we did we did the triage practice, like where we would tag people green, yellow, red, black. So I do know how to do that as well in case I need to. We do pre-assign roles and responsibilities, and there is a straightforward policy through Toledo Hospital that we follow during disaster, and each staff is familiar with this plan. It's actually hung up in our break room, so I will show you guys that in a minute because I was able to go through the policies at work and get some photos. We do have a cool tool. It's called RL6 at Toledo Hospital. And this is basically where we submit things that we think are risky. It could be like a medication error, or it could be something like equipment's broken in the room and it could cause a problem. And we put this in the RL6, and then our managers all look at it. And it's not necessarily to get anyone in trouble. It's a way to prevent things from going wrong. Or if things are going wrong because of this, they try and mitigate what can go wrong based on it, because if we can't fix the problem. So the RL6 is a very good tool. And then we also have clear and multiple backup technological systems. So at Toledo, we actually all have a walkie-talkie that is battery powered on our unit. And I really had no idea why until I started doing this project and it was in the bigger policy. And I was like, oh, that makes a lot of sense. So we can communicate with each other if there's a power outage or something crazy. So, compared to the standard of excellence, according to an article from the National Library of Medicine, disaster preparedness in hospitals is critical to effectively managing crises. So, based on, all the proactive measures that I discussed on the further slide, Toledo Hospital does have an efficient response plan to that, and we do have trained staff. But one thing Dr. Benton really didn't touch on was our resource allocation in the hospital and how many resources that we actually had to allocate. And I do know that in oncology, right now, we are a little short on IV fluids. We do also, I know throughout the whole hospital, just being emailed, we have a shortage right now of N95s. So if you have a COVID patient, you either have to wear a capper or you have to reuse an N95 like consistently throughout your shift, which was a problem that we did see during COVID. And then another problem that we do have at Toledo Hospital as well is we just simply don't have enough staff. So sometimes we can't even staff the unit. So how are we supposed to respond to this huge community disaster if we don't even have enough staff? Um, so inventory of resources is paramount as resource allocation according to the National Library of Medicine as well. I do know that in our policy it is written out, you will see in a minute. It is written out of where our resources go to during our disaster response. However, if we don't have those resources, they can't go anywhere. So that is a problem that Toledo Hospital does struggle with. So, oh no, a disaster. What do we do? Well, at Toledo Hospital, we have our little plan. Um, so the emergency operations plan and the incident command system is something that everyone at Toledo Hospital is actually familiar with. So not only do those people that you saw on my third or fourth slide when I introduced the team, not only do those people have a lot of responsibilities, but we also on our unit manager has a lot of responsibility. We have a unit manager on day shift and night shift that is responsible for the assessment of like our immediate and potential needs of equipment, supplies, staff, like putting us where we need to be because obviously oncology patients aren't going to be a very big priority most of the time during like a triaging type of situation. So we'll probably go to another department like the like emergency room or like just treating like the green patients or something. So she's responsible for all of that. And then she reports to like the people on the bigger disaster team. And so we are all familiar with who to contact, supervisors, everything. And then here is the plan, just in case you're panicking. So our flow sheet is actually hung in our break room. So that's what I was talking about earlier. Just who to notify first, and then they notify from there. So that just kind of tells us a little bit about what's going on. And then the thing on the left is really wonderful to me that I was digging through the policies and I was finding. So we have like where our existing patients will go, where our command center will be, so where we can find all of the leaders if we need them, where we'll receive the patients, all the treatment zones, if we need decontamination for whatever just happened in the community, it's right there as well. And like where we put the families and the discharge patients. So I think that that is wonderful that we just have all of that laid out. And so does Toledo Hospital's response plan meet the standard of excellence? I would say so. I just liked this quote from I just like this quote from the National Response Framework. And it's just basically saying that our job is to protect and save lives and the environment and just stabilize the incident and make sure that our patients are getting taken care of during this and setting up our response properly, like Toledo Hospital has, where we all know it, we all are able to perform it at any moment. Um, that enables very good recovery and it allows us to possibly be able to save even more of our patients, which is always the goal. So how will we ever recover? So we prioritize debriefs with staff at Toledo Hospital. After all of our codes and things, we actually have to document that we did a debrief and who was present at the debrief and what we talked about. And I actually don't mind having to do that. I think there's a lot of times that certain things get missed or certain people feel bad and they feel like things are their fault and they're not necessarily they are. But I think it's important to talk about just kind of how everybody feels and what we feel like we can do better for next time. And then ProMedica as a whole, not just Toledo Hospital, but all of the ProMedica area hospitals actually have a thing called the Employee Assistance Program for us. And we provide assistance to just staff members that are struggling. You could be struggling with mental health, with finances, anything, really anything, and ProMedica will provide you with resources. I know some people who also struggle with like food insecurity through this program also are able to get like bags of food and things to take home to their family. So I do really appreciate this program a lot and you can use it as many times as you want. So it's there if we ever need it. So do we meet the standard of excellence? I think for our staff that we do, because we provide a flexible structure, we focus on complex recovery dynamics and realize that not everybody's recovery is the same. Not recovery is cyclical, not everything happens in a linear process. Sometimes things happen together. There's not necessarily stages of recovery. It's just kind of all thrown together at once, sometimes, especially in the middle of a disaster. So I do think that for our staff, we meet the standard of excellence, but for our patients, that we don't necessarily yet. And I think that that is something that instead of just being the employee assistance program, we should probably expand that a little bit and make it more accessible to our patients. Because I know a lot of times we provide our patients resources, but only when they answer those questions that are like about food insecurity and getting transportation and medications and things if they answer them truthfully. And a lot of people are worried about answering those questions truthfully and would rather have sort of an anonymous kind of approach to it. And so I think we should open up the employee assistance program to patients as well when they want to remain anonymous in order to facilitate them throughout their recovery. So in conclusion, ProMedica Toledo Hospital versus the emergency plan equals success. So I think ProMedica Toledo Hospital has a good response plan. Obviously are some areas to work on, but there was a lot that I learned about disaster recovery that I never really knew that we practiced, and I never really knew why we did it. And it was really fun to dig through all the policies and just learn. Um, Here are my resources, and thank you for listening today.